Hello and welcome to Mental Health Matters in Cass County Tools, Signs, and Support, brought to you by You Matter Cass County Collaboration. My name is Heather White from Compass Health Network's Youth Suicide Prevention Program. I'll be your host and presenter for this special You Matter Mental Health Awareness Month presentation this evening. I'm so excited to have the opportunity to bring this event to all the members of our You Matter Cass County community. Let's go ahead and get started. I'd like to welcome all who were able to join this live presentation and say thank you so much for taking the time to be here. I'm going to go over a few housekeeping items in our agenda for this evening. First, this is a live recorded presentation. You'll have access to the recording on each of the You Matter Facebook pages within 24 hours after the presentation ends. During this live presentation, the Q&A chat feature is available for questions. Questions will only be seen by me to allow confidentiality and respect for individual privacy. I'll review the chat at the end of the presentation to answer questions. For our agenda, I'm going to share a bit about each of the You Matter organization and who leads the way for each program, along with some of the information on our current You Matter Cass County collaboration. We'll then move into an educational presentation about suicidal ideation, the 988 Suicide and Crisis Lifeline, and safety planning. The presentation will end with some local resources available for support, ways to connect with You Matter in your area, and any questions you have. I first want to start by sharing how each of the 3 You Matter programs in Cass County were formed. The history of You Matter in Cass County started in Raymore in 2012 after the 3rd student in 16 months was lost by the community. It was an incredibly hard and sad time for the community. Parents in the community felt a void and saw that youth and young adults were vulnerable and needed to be reminded that they were never alone. These same parents and community members started an amazing grassroots movement called You Matter. This movement was embraced and supported by the community and school district and is now guided under the Raymore Peculiar Public School Foundation. It continues to build on the initial movement to support the youth of the Ray-Pec community. After a period of establishment and seeing the success of the Ray-Pec program, the Belton Education Foundation and Belton Cares worked together to form You Matter in Belton in 2019. And in 2022, after a mother lost her son, she committed to making that loss be a form of light for others and established You Matter Archie with the support of school district staff and community members. Each of these organizations have a mission rooted in the need to come together as a community to serve the youth and remind them they are loved, they are cared for, they are supported, and they are heard. They matter, and you matter. Now, I want to just take a brief moment to introduce to you each of the leads of these programs and share a little bit about their why. These are amazing ladies. Let's go ahead and get started with Ray-Pec. This is Andrea Cox, the You Matter lead for Ray-Pec's program. As a Ray-Pec parent and motivated advocate for youth mental wellness, she volunteers her time and energy supporting the Raymore Peculiar Public School Foundation's goals as a board member. Andrea's also devoted a lot of time as a member of various Ray-Pec school PTA groups and the PTA Council, serving for 12 years and was honored the Volunteer of the Year in 2020. Her passion to support and empower youth wellness and well-being in her community is why she is so committed to You Matter Ray-Pec and the students it serves. Now let's move on to Belton. The lead for You Matter Belton is Jennifer Mata. She's currently the assistant for Belton Education Foundation. As a proud Belton High School alumni, Jennifer has deep roots in the Belton community and a lifelong passion for supporting students in the schools. Over the years, she has served on multiple parent-teacher organizations. Her commitment to education and student success runs deep, and she's grateful to serve in a role that allows her to give back to the same district that shaped her own journey. Jennifer brings enthusiasm, community spirit, and a genuine love for Belton students to everything she does. She considers it a privilege to work for the Belton Education Foundation, where her passion and purpose aligns every day. Now let's check out You Matter Archie. In Archie, the UMatter lead is Christy Morton. She lost her beloved son Hunter to suicide in February of 2022. He was in middle school. He had a core friend group and was on the football and wrestling teams. Everything about his life appeared normal, which made his loss even more jarring. Christy made a conscious decision to repurpose her grief into something productive and positive, founding UMatter Archie to provide mental health resources and support through the school district's Care Connector, word of mouth, teacher referrals, or on-site mental health providers. Christy's passionate about her UMatter program and how it serves her Archie community. Now let's shift gears a little bit and talk about our UMatter Cass County collaboration. This Cass County UMatter collaboration has evolved through a variety of connections in the county. If you're a member of the Cass County community, you may have noticed a themed UMatter night at high school sporting events from time to time. In addition, as each of these UMatter organizations support their own community, they're also wanting to embrace the surrounding communities as well. This motivation from each program, along with interest from myself and Compass Health Networks and a program through Cass County Health Department, we established a meeting to discuss some of the possibilities. After exploring those possibilities, we realized that Cass County is a vast space, and having an in-person event might be challenging to get all UMatter communities in one place. So we settled on our first collaboration being this presentation, providing to all of the communities virtually. We're excited about future collaborations and are open to many possibilities. We'd love your feedback or suggestions about events, education, or resources available in the community that you think we should share or could share. You'll have an opportunity at the end of this presentation to share any ideas or thoughts that you may have. Now that we've talked a little bit about each of these UMatter programs and our collaboration, I'd like to shift over into our education for this evening. Okay, so we're going to dive into some brief information about suicidal ideation, the 988 Suicide and Crisis Lifeline, and safety planning. This information is going to be provided as tools you can put in your mental health toolbox to assist with supporting yourself and others, because we all matter. These tools can provide a way to open up and allow hard conversations to happen in our community. This topic can trigger strong thoughts, feelings, and emotions, so please use self-care if needed. If you've recently lost someone to suicide, this training may be a little too difficult today. This information is going to be provided on each of the Facebook sites for UMatter, so you can view it at a future date if that is better for your wellness and mental health. So we're going to start by discussing suicidal ideation. Suicidal ideation is incredibly complex, and I'm going to share different levels or types of ideation, and we'll explore how each type of ideation can affect the risk of an individual, and how to use a suicidal ideation thermometer to talk about struggles with ideation. Let's go ahead and get started with that. Okay, I'm going to give you a moment to view this visual. As you can see, suicidal ideations are separated into 4 categories for the sake of this specific tool. No ideation, passive ideation, active ideation, and acting on ideation. We're going to explore each of these categories, and I'm going to give you examples of what you might hear in that level of ideation. Starting at the bottom in green, you can see no thoughts. In a perfect world, this is where we would like every person in our community to live. But we realize life challenges, lack of healthy, effective coping skills, and limited supports can cause individuals to have suicidal ideation. Also at the bottom are random intrusive thoughts. These are passing thoughts or curiosity about death. The curiosity about death is there, but no suicidal ideation is actually attached to it. A person in this level might say, I wonder what dying feels like. Or, do you think people might come to my funeral? Next, we move into that yellow or passive ideation category. Thoughts of morbidity is a level where a person thinks about their own death or dying, but not specifically by themselves. This person might say something like, I wish I could go to sleep and not wake up, or everything feels overwhelming and I just don't want to be here any longer. Usually they do not truly want to die, but they're desperate for the pain they feel to end. And then we move to suicidal thoughts with no plan or intent. These people think about killing themselves, but they don't have any details of a plan and no intention to act. A person at this level of ideation might say, I've thought about killing myself, but I don't know how I would actually do it. They may feel like a burden to others or just want the pain to end. Then we move into active ideation, as you can see in orange. Suicidal thoughts with a method but no plan or intent. This is someone who has an idea of how they would end their life, but no specific plan or intention to end their life. A person at this level might say, I have thoughts about killing myself, taking pills, getting my dad's gun, finding some rope in the garage, but I've never actually made a specific plan of where or how I would do it, and I don't think I would actually do it. And then we move into suicidal intent with no plan. This person has a true intention to kill themselves, but does not have a specific plan. This person might share that they have really strong thoughts of their death by suicide, but struggle to identify the plan in the moment, but they do intend to make the effort to reduce that pain and distress they feel by ending their life. Many times they voice that they feel like they're a burden and just want their life to end as well. The next level is acting on suicidal ideation in red and is the highest level of ideation. Suicide with a plan and intent is when someone has a specific plan of how, when, and where they want to die with the intention of actually carrying it out. A person with these thoughts will be able to identify a specific method that they're going to use, the location that they will do it in, and an environment that they identify to end their life. And then the highest level of ideation is acting on the suicidal ideation by utilizing an initiated plan or impulsively acting on suicidal thoughts. With all these levels, it's important to note that each level of suicidal ideation is valid and doesn't dictate the amount of pain, intensity, and distress a person may feel. Also, a person may be in between levels or jump around levels at different times, and that can make understanding a person's support needs and challenges more difficult. Children as young as 4 to 5 years old can have suicidal ideations. And many children and adolescents between 8 and 12 experience intrusive thoughts of death and thoughts of morbidity as they're challenged with development, understanding how to use coping skills, and ways to manage feelings, thoughts, and emotions as a natural development. It's important to open up communication with youth and allow them the opportunity to share feelings and thoughts, along with allowing them to know that they can be supported when these thoughts arise. So let's shift into how this visual can be utilized or used as a tool for you to have these conversations about hard topics that can be really uncomfortable sometimes. This thermometer can be something that you pull up on a screen or print out to show a person. You can share that you recently learned it can be normal for all kids to have thoughts of suicidal ideations, and you want to have an open talk about it in case the person is struggling, needing support, or just an ear to listen. You can then show them the tool. You may have to review the different levels of suicidal ideation, and then you can ask these simple questions. Have you ever thought about suicide? Can you point to the color you've felt before? If a person has challenges with consistent thoughts of suicidal ideation, you can ask where they currently are in the thermometer, what the highest level they've ever felt, and when it was. This tool can be a gentle way to start a conversation that can feel scary or hard for both you and the person that you're talking to. It allows for a visual way to communicate struggles and needs for support. This is just one of the tools that you can use to assist you and your community in supporting the youth as they grow, develop, and allow them to feel understood and supported. So now that we have this tool to identify suicidal ideation, if a person does identify suicidal ideation, it's important to have ideas of what to do next. So let's look at some options available. For most people, when they're struggling, or if you find out a person you care about is struggling, it can feel like an emotional and overwhelming time of fear, panic, and numbness. These feelings can be overwhelming, and knowing what to do next can be a little challenging. It can be hard to navigate what options are available, so let's review a few options of how and where you can get started in the process to get support or help. Many people start the process of getting help by first reaching out to their support systems. These are our friends, family members, neighbors, clergy, coaches, and any other person in our life that we have found support in. There are also a variety of community services or supports available. This can include your primary care doctor, a therapist, school counselors or administration, support groups, or urgent cares in hospitals. And there are also crisis supports like the 988 Suicide and Crisis Lifeline, which is available 24 hours a day, 7 days a week, 365 days a year. We're going to chat about some of these community resources and services available in Cass County, but first I want to spend some time talking a little bit about 988. Many people have heard about 988, but may struggle to know exactly what it is, why people use it, how it is used, and what to expect when you call. We'd like you to see 988 as the second tool we're sharing today and want to dig into it a little bit more so you feel comfortable using it for yourself or others in need. Let's start by looking at some of the reasons a person might reach out to 988. We've found that many people who know about 988 think that it's only for people to call when they're suicidal with a plan and intent or in an overwhelming emotional distress or crisis, but it can be utilized for so much more. As you can see on this list, people often call for challenges with substance abuse. They may be worried about another person or have experienced trauma or feeling general anxiety or depression. They may feel lonely or hopeless or have relationship or family problems. Sometimes distress around sexual orientation, finances, school, or a job can escalate into a need to reach out as well. And sometimes those struggling to think clearly can benefit from just reaching out to the 988 crisis line. Now let's look at different ways we can reach out to 988 to get support, because there's a lot of flexibility in how you can get support that best works for you. The 988 Suicide and Crisis Lifeline is available 24 hours a day, 7 days a week, 365 days a year. It is free and confidential support anytime you need it. With 988, there are 4 ways to reach out for support. There's an option to call, text, chat, or video phone. We're going to look at each of these options and talk through what to expect. Let's start with making a call to 988. When you initially call 988, you're going to hear an automated greeting message that will prompt you to make a selection. You can either stay on the line for a crisis specialist or press 1 for the veteran crisis line or 2 for the Spanish network. 988 offers crisis support in English and Spanish, as well as translation services in over 250 languages. After you've made your selection, you'll hear music while being quickly routed to a trained crisis specialist that's in Missouri. In Missouri, the line is answered by a crisis specialist in an average of about 37 seconds. The crisis specialist will answer the phone, introduce themselves, and listen to you to understand what you're experiencing and how it's affecting you. Then they will work with you to address your immediate needs, offer support, and connect you to any local resources that you feel might be beneficial. A similar process occurs when you text 988. When you send a text to 988, you'll be asked to complete a short survey to share what you're experiencing. Texting 988 starts a real-time conversation with a local crisis specialist ready to assist you. Once you're connected, the crisis specialist will work with you to understand what you're going through and how it's affecting you. They will work with you to address your immediate needs, offer support, and share resources that may be helpful. Texting is available in English and Spanish. Next, we have the 988 chat. Chat's available in English and Spanish through the 988 Suicide and Crisis Lifelines website at 988lifeline.org/chat. When you chat 988, you'll be prompted to complete a short survey to share what you're experiencing. You'll then be connected to a crisis specialist who will work with you to understand what's affecting you, offer support, and share local resources. Let's take a look at that short survey to give you an idea of what to expect. These 3 columns show the short survey required to start a chat with 988. In the first column, you'll see 3 required questions. The first is your zip code to allow 988 to find a crisis specialist specifically in your area to respond and give you the best and most reliable support and referral possible. The second required question is, do you have thoughts of suicide? And the third is, how upset are you? You then have the option to expand for more optional questions. The optional questions are on the second column and can allow for more detailed immediate support but are not necessary. The third column asks for your phone number in case of disconnection. This is also optional, but always encouraged in case you're in the middle of a conversation and really want to continue that with the same person. Once you've answered the required questions, you'll hit start on the chat and we'll have a crisis specialist accessible to speak to you. Next, let's look at 988 video phone access. 988's video phone allows individuals who identify as deaf, deafblind, deaf-disabled, hard of hearing, late deafening, or any American Sign Language user to connect directly to ASL Fluent 988 crisis specialists. You can dial 988 on your video phone, and once connected, follow the prompts. You'll be asked to answer some questions regarding your current situation and what you're experiencing. A trained crisis specialist will work with you to understand what's affecting you, offer support, and share local resources. Now that you know ways to reach out to 988, let's take a quick look at who is answering the 988 crisis line closest to you. As you can see on this map, Missouri's 988 services are staffed by a variety of behavioral health providers throughout the state. On the bottom left, you'll see the list of names, and you can see where their designated locations of coverage are on that map on the right. Cass County has Compass Health Network as a provider for 988 services in our area. Now that we know what organizations are answering, I'd like to share a little bit about Missouri's crisis system of care. Missouri's behavioral health crisis support is not just limited to the 988 Suicide and Crisis Lifeline. Missouri also has a crisis system of care that includes a mobile crisis response service and behavioral health crisis centers throughout the state. If a person is struggling and 988 support is not enough for immediate needs, there's a mobile crisis response service that allows for a member of a behavioral health crisis team to go to that person in the community and assess, support, and provide guidance to allow for quicker and easier accessibility to behavioral health supports at an individual's most challenging moments. In-person support is another option to address urgent and emergent behavioral health challenges in our community. In addition to mobile crisis, there are a variety of behavioral health crisis centers that allow immediate access for support. They are available to assist with a variety of urgent and crisis behavioral health needs. We'll review those options in Cass County coming up. But before we do, I'd like to answer some common questions we often get, especially from youth, regarding the 988 Suicide and Crisis Lifeline. I'm going to briefly talk about the three most common questions we get about 988 from youth in our community. The first one is, can the hotline find out where I live? And the simple answer to that is no. The 988 Lifeline has geolocation services that do allow for a general idea of where a person is calling from to route them to the closest crisis specialist in their area, but they cannot identify an address using that geolocation service. We do this for confidentiality purposes. The second question is, will my parents find out if I call? And again, the answer is no. Parents will not find out unless you provide information to allow that crisis specialist to support you in having conversations with parents or guardians. The crisis specialist will encourage the youth or young adult to explore their trusted adults or support systems and can offer support in talking to that trusted adult if or when needed. And the third question we often get is, can I call for a family member or friend? And the answer to that is absolutely. We highly encourage this. Many times a person will reach out to a trusted friend, family member, or someone in their support system. You may not know what to say or how to help that person struggling, and 988 is a great way to get guidance on how to support them. Also, many times individuals are fearful to make that first step towards getting help from 988. If you sit with them to start the call, or as they are calling, support them, it can be very helpful and empowering to that individual who's struggling. This can also be a great way for both people to get guidance on the best supports and resources for you, your friend, or family member, and it's all at the tips of your fingers. Now that we've chatted about our second tool, the 988 Suicide and Crisis Lifeline, let's look at some community resources that you can reach out to in or near Cass County. I'll separate these resources into 4 groups. First, outpatient and connective resources. Second, behavioral health urgent cares and crisis centers. Third, behavioral health hospitals. And fourth, behavioral health intensive outpatient services. The lists provided are not all inclusive of all the resources available in the Cass County community, but are some of the most accessible resources or organizations available to assist with your needs. Let's go ahead and start by looking at a few outpatient and connective resources. This list of outpatient services are available to provide a variety of assistance. Many have therapy, support groups, and case management or community support services. And some may even provide medication management or assessments and referrals as well. The closest behavioral health urgent care is Rediscover Behavioral Health Urgent Care in Raytown. They serve adults and youth 5 years and up. They take walk-ins from 9 a.m. to 7 p.m. 7 days a week. You can expect an assessment by a qualified mental health professional, along with an opportunity to meet with a therapist to discuss current challenges or struggles, meet with a psychiatrist if medication could be a support, and a community support specialist to assist with providing resources and long-term connection if needed. There are a few options for behavioral health crisis centers near Cass County as well. Compass Health Crisis Center is in Raymore, and it serves adults and is 24 hours for accessibility. There's also Comprehensive Behavioral Health Crisis Center in Independence. It also serves adults and has 24-hour access. They provide immediate 24/7 services in person for stabilization of individuals experiencing a mental health or substance use crisis. They can be a great alternative for emergency rooms or jails for someone who is struggling. They offer rapid assessments, short-term observation up to 23 hours, and can triage to connect individuals to community resources to assist with preventing hospitalization. Now let's look at some of the options for behavioral health hospitals in our area. This list is not inclusive of all the resources offered in and around Cass County area for behavioral health hospitals, but it is a list of options that are most often utilized as a referral when youth and young adults are struggling and in need of behavioral health hospital inpatient services. It can be very scary for a youth and their family to seek services in a behavioral health hospital. Most stays average 4 to 7 days, but can be shorter or longer based on an individual's needs. Many times, short-term inpatient hospitalization can be really beneficial if someone struggles to stay safe or has an active plan or intention to hurt themselves or someone else. Another benefit of behavioral health hospitalization is the immediate access to supportive medication changes or additions, and access to therapy and support group services and coping skills education. An alternative to inpatient hospitalization is intensive outpatient services. Let's take a look at some of those options available in the community. IOPs, or intensive outpatient services, provide therapy, support groups, and skill building. Most programs require about 12 to 15 hours a week of attending services. Schedules can vary, but most usually are about 3-hour blocks daily or every other day, depending on a person's need. Some programs have daytime and evening options available to assist with supporting you around your life and lifestyle. This is a really great middle ground between inpatient care and traditional therapy for support and behavioral health needs. Most individuals will participate anywhere from a few weeks to a few months in this type of program, but timeframes for each person may vary. Now I'd like to share a little bit about an online crisis resource to assist you, no matter where you are in Missouri, to find the closest services available to you. The Missouri Behavioral Health Council has a crisis resource directory that you can utilize to assist with identifying the resources closest to you. The website allows you to click on the county you're currently in, and it will pop up with a variety of resources, including crisis centers and urgent cares, along with community behavioral health liaisons, who are individuals that can reach out to you for assistance, guidance, and support that can get you connected to behavioral health services closest to you as well. This is a great tool to assess and identify any resources throughout the whole state. Now we're going to shift over to our last tool to add to that mental health toolbox, and it is safety planning. A safety plan can be used to help an individual experiencing mental health challenges, self-harm, and suicidal thoughts with a real tangible way to reduce risks and increase safety. Let's look at what a standard safety plan looks like and learn about each of the components of a plan. This safety plan has components. Each component builds on the next to allow a person not only to understand when they're starting to struggle, but also providing a simple to use list of people, places, skills, and supports available in that moment. At the top, there's a section for warning signs. This allows a person to identify what thoughts, images, moods, situations, and behaviors that could eventually develop into a crisis or a struggle for them. Next is coping skills. We want to identify internal coping skills that someone can do to keep their mind off of a problem without contacting another person. Sometimes when support systems are not available or an environment is not one where a person feels comfortable seeking assistance, they have their own internal active coping skills that they can utilize on their own. Having a variety of coping skills can be incredibly beneficial to reduce risks of safety concern. Then we move on to identifying safe people and safe places. People that provide distraction can be beneficial when struggling. We always want to identify specific locations or phone numbers along with names of individuals or settings available to assist in reminding that person what's available to them. And sometimes the people we want or would like to be around to help distract us may not always be as beneficial to help us if we are in need of help. So we also have a separate section specifically for those that can help us versus those people that can just distract us. And then we move on to professional supports. For some people, they may already have active professional supports like a doctor or therapist or support group that they can engage in. But if a person doesn't have those options available, we always encourage listing out 988 as a reminder as one professional support, and then exploring if they would feel comfortable utilizing a mental health urgent care or a crisis center added to that safety plan as well. We never want to force somebody to put something on their safety plan that they would never feel comfortable with or they would not utilize. Another step to the safety plan is really trying to understand if there's a risk to that individual and identifying ways that they could potentially harm themselves. This is anything that could be lethal or harmful to the point that puts the person at risk. We want to reduce those risks by identifying and removing that risk to make that environment a little safer. If a person identifies something that can put them in harm or risk, we definitely want to address how to limit access to that lethal mean or risk factor. And then as you can see at the bottom, a reason for living is how we end. This is the most critical and crucial thing that we want to know about a person. What makes you want to stay alive? What makes you feel like life is worth living? Many times reminding a person of why they've chosen to stay alive or their motivation to stay alive while they're struggling can have profound effects on resisting that urge to harm themselves. This safety plan is something that anyone can use, but often you'll see it as a resource that is utilized by psychiatrists, therapists, doctors, and all mental health and behavioral health professionals. Here's a sample safety plan created by a young adult. As you can see, a safety plan should be written in the writer's words as they're writing or reading it. This allows more connection to the plan and purpose behind it. Every safety plan is different because every person has their own individual warning signs, coping skills, support systems, risk factors, and reasons for living. This is a tool that is utilized often by therapists, crisis support providers, doctors, and medical and mental health professionals, but it's also something that any person can assist another with. Think about creating a fire evacuation plan for your family and home. This safety plan can be seen in that same light. I encourage you to identify your own safety plan or reach out for support and assistance to get guidance on how to create a safety plan for yourself or someone else. For an individual experiencing mental health challenges, self-harm, and suicidal thoughts, this tool is a tangible way to reduce those risks and increase safety. We realize that some of this educational content may feel heavy for some. It may have triggered your own thoughts or challenges with mental health or reignited some fears or concerns about others. We want you to remember, you are not alone. You matter. Your story is not over, and our You Matter community is here for you. Are you interested in participating in You Matter? Each You Matter organization has a variety of ways you can engage with them. For some, liking or following or subscribing to the content shared by each You Matter social media is a great way to start. There are also many ways to engage with each organization through community events, fundraisers, and just simply engaging and giving worth to the youth in the community. It takes a village, and we would love for you to consider being a part of that village for our youth. Let's take a look at some of the ways you can engage in the You Matter organizations and the collaborators for today's content. You can reach out to Jennifer Mata for You Matter Belton, or check out their information on their website and Facebook page. You can reach out to Christy Morton for You Matter Archie, or check out their information on their website, Facebook page, or Instagram. You can reach out to Andrea Cox for You Matter Ray Peck, or check out their information on their website and Facebook. In addition, I'm going to share my contact information as a community resource for support and connection. I'm Heather White, an Education and Outreach Specialist for Compass Health Network. I'm currently working with a grant that allows for suicide prevention, education, and outreach for our youth, young adults, and youth-serving individuals and organizations across the middle third of the state of Missouri from Kansas City to St. Louis. I have a variety of educational topics appropriate for all ages and needs to support with reducing suicidality for our youth and increase awareness and support. This includes availability to give presentations, provide educational workshops, or assist with tabling events. I would love to know how I can support you or your organization to increase suicide prevention awareness in a comfortable and safe environment. We are at the conclusion of our presentation for this evening. I'm going to go ahead and check the chat for any questions or comments regarding the presentation. Also, if you're seeing this presentation at a later date or have any questions or thoughts to share, we'd love to hear from you. Use the QR code attached to this page and send us your questions or thoughts. What can we answer for you? What types of content would be beneficial for the youth and families of our community? Any suggestions for events, topics, or the youth-serving organizations that we can explore? Feel free to make your thoughts and suggestions heard. We want to hear your voice. So let's jump into the chat.